Hi, my name is Gao, and today I'll be discussing about stop using contraceptive methods. Well, contraceptive methods can be very harmful and it could take a toll on your body. So ask yourself whether you want to use contraceptive methods or find the alternative. What is birth control? Well, birth control is the deliberate use of preventing pregnancy. Well, talking about preventing pregnancy, people use contraceptive methods to prevent pregnancy because this is due to sexual intercourse. And contraceptive methods prevent a fertilized ovum from implanting onto the uterus wall. So, same goes to male or female, which is known as sterilization. Well, talking about contraceptive methods, there are few methods that people use it very frequently. And one of the methods that are very well known among women is COCP. What does COCP stands for? It stands for Combined Oral Contraceptive Pill, which is known for producing estrogen and progesterone, which this prevents egg production, which is known as ovulation. It prevents ovulation, but it does have its disadvantages too. Talking about disadvantages, what does it cause? Well, you have a high risk of getting blood clots. Some women have side effects, and it does have a certain percentage of power to cause cancer. And people with different medical conditions, such as high blood pressure, it really takes a toll on them. Contraceptive injection. Well, it contains progesterone and it releases into the body very slowly. But when it comes to its downsides, well, it does delay your fertility. Your period doesn't flow as regular as it's supposed to. Other than the two methods that I previously explained, this method might have been known as the safest method to take, which is intrauterine contraceptive device, IUCD. Well, this is a copper device that is put into the womb. Well, this device stays there at least up to 5 or more years in the uterus, but it prevents the ovum from meeting the sperm, so it prevents fertilization. It might be very effective, but when you start having your periods, it becomes very heavy and it becomes severely painful during your periods. So by looking at all of this, I can conclude that firstly, it leads to heart attack. Heart attack is when you start taking birth control pills and you are from a certain age of group number, which is of 35, and you're a smoker, and at the same time when you're taking birth control pills, it highly contributes to heart attack. Secondly, leads to blood clot. Well, taking birth control pills leads to blood clot in ways of causing blocks in your lungs and in your limbs. And this is very severe because it directly leads to heart attack. Thirdly is weight gain. Women has reported slight weight gains taking birth control pills, which is caused by fluid retention or induced estrogen. Fat deposits in the hips, in the thighs, and in the breasts in the female body. Weight gain also may be related to reduction in physical activity or increased intake of food. And fourthly, this is not suitable for everyone. Some women should not take pills if they have specific conditions, including some types of diabetes, liver disease, cardiovascular disease. So, women with risk factors for heart disease, such as those with high blood pressure or those who are obese, are also in higher risk when they are on the pill. Finally, delayed pregnancy. When you stop the pill, it may take several months or longer to begin ovulating again. But you cannot ovulate in your desired time or in your desired period when you want to, because it may take several months to start ovulating again. Okay, right now I'm going to be talking about how to overcome and alternatives to contraceptive methods, and which is very normal, natural birth methods. Teach women to determine their fertile phase, which is practically from 7 to 10 days. And during the 7 to 10 days, women usually avoid intercourse. So talking about natural birth control, how does natural birth control work? Well, it works in few ways, which is the FAM and the NFP, which is known as symptothermal method. Symptothermal method teaches women how to observe, chart and interpret her working temperature, which is basal body temperature or BBT. A cervical mucus to understand what days she is fertile and what days she is not fertile. She then knows when she is likely and when she is less likely to become pregnant for intercourse. Because at the end of the day, FAM is a very beneficial method because it is a very good natural method, and at the same time it does not provide any side effects. Not only that, it promotes self-awareness to yourself, and especially for women who cannot or will not take hormonal methods, this is a very good alternative. And at the same time, complying to religious beliefs and lifestyle, because it makes you and helps you communicate more with your partner, and at the same time you can enjoy a good variety of romantic and a very good sexual activity with your partner. Well, there are other methods other than FAM methods, but this method is less effective. It is known as rhythmic calendar method. It is less effective, but it is practically as simple as taking a woman's cycle from the past and then calculating her fertile days and making an estimation of when can she take or make or carry on with a sexual intercourse. So what can we conclude from all of this? We can conclude that the pills are not effective enough because it causes you side effects and it doesn't prevent you from sexually transmitted diseases. And at the same time, women do not take it constantly. They tend to forget and they tend to not follow the timing to take the pill, hence it is not effective anymore. So the best method is always naturally preventing it, which is a natural birth method. And I believe with this, you can prevent pregnancy and you can avoid yourself from all trouble and harm and protect your health. Thank you.